All right. What we're going to do first is to see together what do we think the effect of compression is on the body. Okay? So when you do that, imagine this is a muscle, and when you're pressing, you're kind of deforming it. You see? You're really pressing, and then you're leaning. What is the effect of doing such compression?
Release.
Of what?
The blood?
Right. Let's talk about the blood. Imagine that you have this sponge immersed in blood. And remember what we did yesterday with the towel and the blood? Remember that? So imagine when you're compressing and releasing, compressing and releasing. What would be the effect on the blood? It's a pump. It's really a pump. So when you have a muscle that is tight, so by compressing and releasing, every time you compress, what happened to the blood? Squeezed out. Every time that you release, and fresh blood comes to that area. Again, you press, you squeeze away. You release, new fresh blood comes to that area. So in a way, it's like, you know, when the car is stuck, you put on second gear and someone push you, you give the muscle a kickstart. Yeah? Just by saying, this muscle is tight. Right, and remember, the pet dressage as well does that, but not as specific, yeah? Okay. What else? So pumping, very important. What else the effect of this technique?
Soften the muscle.
It may soften the muscle, right? So you can kind of stretch the collagen fiber a little bit, yeah? If you do it with two fingers, you can kind of little bit stretch them, yeah?
Does it awaken it as well? Awakens the muscle?
What does it mean, awaken? What?
Or if it's sort of tense and sort of not moving,
So it?
make it move?
Yeah, make it move, yeah? So imagine that you have here two muscles and they're all kind of glue together. What is the glue? What is the glue that the body uses? How does the glue called?
Oh gosh.
Sorry?
Tendon?
Tendon? What is a tendon made up of? Collagen fiber.
Fiber.
So you need to glue certain things, yeah? Imagine that you have a cut here. You see the cut? This is an injury to the muscle, okay? Is it going to stay like that? So you need glue, super glue, right? So you use collagen fiber. So the collagen fiber would be built, it's like sewing it, yeah? But this collagen fiber, we have a special name for it. It's called scar tissue. So scar tissue is where there is an injury of a cut or sprain, basically something like that, yeah? So you need to kind of glue it together. So you put collagen fiber, however, collagen fiber is such a good super glue that it starts to glue other things. And what it does, it glue and then it kind of compress it. So do you see what's the problem now? Pinch, lack of blood supply, same problem. So here, that would be a fantastic place to do the compression on scar tissue. So how do you know there is a scar tissue there? You may not know, but they may tell you, okay, I've injured my hamstring, or you're trying to take through the case history to think where are you going to invest in your palpation and treatment, yeah? So someone who had a sport injury here, I may look to find if there are some tenderness. Or how do you think the scar tissue would feel?
Lumpy.
Lumpy, hard, yeah? Kind of a knot, yeah? A knot. Maybe tender, right. What do you think happened to an area that are lacking blood supply? Could the client feel something different there?
Pain?
They may feel pain. Because when you have no blood, it get like lots of waste product, pain, stiffness. So you could, it's kind of the same old, yeah? Same old, when you have this tenderness and you start working on the tenderness and pain, it may release it. So one of the effect of compression would be also feeling better, less pain, be more active, can do more stretch, you know. It can then make the person decide to change and do some more maybe exercise. So there is a cascade of events that can make them do more, be more active, and yeah, from there they might feel different as well. Anything else, Simon, about compression, that the effect?
I mean, I'm interested in analgesia. Does it have an analgesic effect?
Yes, that's another one that sometimes is just like a natural painkiller. Yeah, when you're pressing on that, you kind of what you do. I give you an example. If you have pain here, what is the first thing that you're going to do? Yes. Why do we do that?
Release the tone. Put
Get the
pressure on
oxygen, put pressure, and when you put pressure,
it. Leaves it. Bit better.
you confuse the brain. So what you do actually, from an area, the brain can feel only one sensation. If there is pain and you start doing that, it kind of confuses the brain and say, okay, there is more pressure than pain, let me concentrate on the compression. Who like tiger balm? Who put tiger balms? Same thing. There is no, it doesn't make any temperature differences. Basically, it burns the skin. So when the skin burned, you feel less the pain. Yeah? So it's kind of interesting that we try to trick the brain. Less pain, more that, oh, now I'm into that. Is that what you meant, Simon? Yeah. So when you do compression, sometimes you talk to the brain a lot. You do talk to the brain of the client and suggest, yeah, to do that. If you've heard about, there are some body therapy technique called Feldenkrais Technique. Have you heard about it?
Oh, is that the pushing
Yeah.
one?
So Feldenkrais Technique sometimes suggests something like that. If you have pain in one area, work on the opposite side even. Try to work on the opposite side to kind of, if this shoulder is really stiff, try to work on the other side and see if you can relax it and you can divert and teach the brain to work in different patterns. Yeah, that's very interesting. Shall we now look into different ways of doing the compression? So can I have a bit of oil? Thank you. Thank you. So again, I'm not going to spend a lot of time doing the other technique, but a few things that I've seen, okay? Body posture, still take the time to really feel what you're doing. So if you find yourself here, if you find yourself there, something is wrong. Especially it's correct when you do the neck. I see still a lot of kind of that. So don't go all the way. Come to the side, do half of it, and then come here and do the upper part, okay? And then come to the side again, if you need, and then come here and do that, okay? Be more close to. Petrissage, fine. You start palpating. Try to have your fingers less extended. And then let's say that you start feeling more with your fingers and you want to work here on that area. Okay? So nothing is new, just a revision. Okay? So the application, the way that you're using your body can be in any way that can be effective. So if you know what you're looking to do, I can just teach you that, and you should decide to do a reinforced hand. Yeah? So you put your thumbs one on top of another, and then try to come close. Or you can use two fingers, one close to another, or side by side. Now the other fingers are quite important. I never do that because my probability of gliding and hurting them is a lot more. I need support. I need stabilizers. And these are all the stabilizers around, so I can do it with stability. Okay. I'll show you a few others. First one I really like doing is, instead of reinforced, I do that. I take the thumbs and press with the opposite, with the pinky side. Can we try to do that together? And why don't you try to press on your thigh this way? Yeah? So you put your thumbs there, and then you put it quite flat. And this hand is always, the lower hand is very relaxed, and then you put your force onto kind of diagonal, and then you don't move, but you just do it really slow. There is an extremely slow movement. Okay? So you can do that. You can even do it with the forearm. So actually, the most of the contact is through the forearm, through the thumbs. But I put the pressure through the forearm. And it's so easy, because this hand is relaxed. And I put so much of my weight, sorry, it was a little bit too much. Yeah, and you basically, you know the sensation of feeling a bit drunk and kind of, you know, being on the pub and, yeah, it should be really easy. Make it easy, don't make it hard and sweaty. Yeah, try to learn smart, not hard. So you can do it this way. You can use your kind of knuckle into putting your thumbs, and actually most of the pressure coming from here. And I will put the other hand just to keep it stable. Good. You can do even reinforced fingers. Now, if you do that, you see that the finger is coming in different size. So what you're trying to do is to make them coming together on the same line and then reinforce them. So you precipitate all the forces going through a small area. And again, maybe not coming from above. The erector spinae is quite long. So what I'm doing, coming from the side, from the outside, and then going kind of 45 degrees in. Oop, now it's over. So I try to elongate the gliding over. If I glide over, that's it. I'm not on the muscle again, I'm onto the spine, yeah? So try to elongate as much as you can. Okay, so revision. Thumbs, reinforced thumbs, that position, that position, that position. I think it's enough, isn't it? Anything else, Simon, that that you remember, or from that position, from the
Close to each other.
compression? Yes, so we did together.
What's enforced thumbs? Is that?
Yes, reinforced thumbs. Every time that you have reinforced, is one on top of another, and that you have more forces going through.
Were you including some movement there, just a tiny bit?
Oh yes, let's now talk about what is the movement, how much movement did you do? Look, effleurage, you do really a lot of movement, right? Petrissage, you do less movement. you can't do pet massage for the whole body. Yeah, you can do pet massage for a specific muscle. So the deeper you go, the less movement you do. Yeah, effleurage, whole, you know. Then pet massage, specified. Then feeling you homing down into where they need. Once you're there, I'll do it here because it will be easier to look. Once you're there and you started it, so take a breath in. I'm going to press onto that note here. Press down, out. Can I go deeper?
Yes.
Yeah. Is it deep enough?
Yeah.
Okay. So once it's there, you barely move. However, you can decide to do some movement. So what's the movement that you can do? You can work, let's say that it's the rectus spinae. So the rectus spinae go up and down, isn't it? You can go across the fiber. You can go along the fiber. You can work in circles, diagonal, or any direction. Now, is there any better way to do it? I don't think so. I don't think so. I don't think that going across the fiber or with the fiber is any different. Some would say yes, some would say no, some would say it's better this way, some would say it's better the other way. Okay? However, what's for me important that you not start doing that, because this is more pet massage. You cannot do deeper work with so much movement. And I will do a game with you to show you. Okay, so you can do only really that amount. And you can't see much, right? But I want you to make the quality important, the amount of movement, very little. And then easing off. Okay, so very, very little movement. You can work in across. If I need to go up and down, I will change it probably to come from here, or do that this way. You can do circles. Yeah, but massage is not a circus. You don't need to do something like firework and like, it's not a show. It's very delicate work. And the deeper you work, you need to be more delicate. And the more people with problem you work, you need to be even more slow, localized, focus onto that. There is a lot of focus. Yeah, I can do effleurage dreaming, you know, like, great. But when I do compression, I really need to be focused. And sometimes focus onto their legs. Because when they are in pain, they would move them. Yeah, so be aware of the whole person, what's going on there. Okay, so we do that. However, also start thinking about the shoulder, coming to here, coming in this position. Yeah, or that position, and bend and move your body to put more force. Yeah, try to do it on the, remember the occipital area? Yeah, so come into here and do it with a little bit of attraction. How about doing it onto the neck down? Not nice, right? Take and squeeze it to the side and lift it, okay? In the afternoon, we'll first time swap the client and do that facing up, so that will be easier. How about the glute? What do you think? Quite good, yeah? Good, quite good. You can do quite strong work. Even here, because there's quite a big muscle, you can use all of your knuckles. hamstring. You know, palpate. You find an area. Get in. How this muscle name? Yes. in Latin.
Is it trapezius?
Gastrocnemius. Yeah, gastrocnemius. Okay. We'll come to it. Don't worry. Okay. So, cyclist. Yeah. Runners. People who work standing a lot. This area. Okay. Should we do a cut? Get you to work.